We've seen in the previous video that it's important to measure image quality. On the one hand, we want to optimize visual quality for content like movies and sports games. In these cases, automatic assessment methods should take the actual video content into account to give the viewer the best experience. In medical imaging, image quality can have a big impact on the diagnosis the doctor makes. A poor image quality may mean a misdiagnosis. Automatic methods can help technology developers to more efficiently test and optimize scanner parameters affecting image quality. In our group, we collaborate with a number of companies and universities that are interested in image quality. Your master's thesis may give you the opportunity to work with one of these companies. There's two ways we can measure image quality. The obvious way is to ask people to give their opinions on a number of test images, but this can be very time-consuming and expensive to set up and execute. With doctors, the logistics becomes even more difficult. Therefore, we'd like to use mathematical models to measure quality. These are algorithms that can estimate the quality as judged by humans. In medical imaging, it's important to consider not just the images captured on the scanner, but also how they're post-processed and how they're displayed on a monitor. We've developed a simulation pipeline together with other partners, including Barco Healthcare, that takes into account all these steps, from acquisition to image viewing to the estimation of image quality reflecting a doctor's judgment. In our research, even when we develop automatic quality measures, we must validate them with human observer experiments. This is an example of one such experiment. This image contains a pathology slide from a biopsy for a possible cancer. In this experiment, we have various images with differing levels of quality, so we ask the doctors to rate their overall impression of quality. Then we ask them to find possible lesions and rate how confident they are that it is a lesion. Not all slides contain cancerous cells. From this experiment, we can relate the quality of the images to how useful they are for making a diagnosis of cancer. In the domain of human observer experiments, we have one topic with 4 possible areas depending on your area of interest. You may want to conduct research either on experiments related to temporal quality, medical X-ray dose, display technology, or general methodology issues. We're actively working on developing objective metrics and conducting experiments with them in various domains. Here's an example of an automatic quality assessment algorithm we've developed for medical videos. On the left, you can see an X-ray movie of the heart, which has been injected with contrast media so that it highlights the vessels so that the doctors can diagnose problems, such as the narrowing of an artery. On the right, you can see the output of the algorithm. Blue areas mean that the vessel is well visible, whereas the areas in white are vessels or objects that are not very well visible or not at all visible to the doctor. The purpose of this algorithm is to help lower the amount of X-ray dose, which can be harmful to both the patient and the staff, while ensuring that the image quality is high enough so that the doctor can see the vessels, any possible disease, and do his job well. In this example, we see a football game. Remember our man who couldn't stream the video because it was too large? Well, we can use compression to reduce the size of the video, but that can cause the video to become blocky, as we saw with the cartoon. So how do we find the right amount of compression? We can again use an automatic algorithm to assess quality. We've developed an algorithm that can better judge the quality of a video by taking spatial and temporal details into account, reflected by the red line. As you can see, a typical measure like peak signal-to-noise ratio, in blue, thinks that all frames have the same quality, whereas the content-aware measure more closely reflects how a person might judge the quality of the video. In the area of objective quality metrics, we have 2 topics in medical imaging. As shown on the left, we'd like to study how well existing assessment algorithms work for MRI images acquired with compressed sensing technology. On the right, we'd like to study the use of different metrics that will quantify the image quality of medical images displayed on tablets and smartphones. This thesis topic is together with AGFA Healthcare. On the bottom, we have a thesis topic on methods for assessing quality in real time. This thesis will investigate real-time quality algorithms with a focus on GPU or multi-core implementations. We invite you to explore the following 4 thesis topics in the domain of image and video quality. The public's eyes will thank you.